Hello, this is Stuart Johnson. I'm from Loyola University Medical Center in the Heinz VA in Chicago. And my poster here is presenting the efficacy and safety of oral vancomycin versus oral metronidazole for the treatment of Clostridium difficile-associated diarrhea. And basically these are data from two large phase 3 clinical trials that were initially designed to look at the efficacy of tolevimir, a non-antibiotic toxin-binding polymer, if you will, that had three arms: the polymer, vancomycin, metronidazole. The polymer, unfortunately, was not efficacious in regard to either of these drugs. The comparison, randomized comparison between vancomycin and metronidazole is the largest trial available, so we thought it was worthwhile to review the data. And what you can see here is the demographics of patients randomized to vancomycin and metronidazole very evenly by gender, mean age, race, severity of disease, prior history of C. difficile episodes, strain type, and prior antibiotic use. So the first measure that we looked at was clinical success. And clinical success is defined as diarrhea resolution in absence of severe abdominal discomfort on day 10, which was the end of treatment. And if you look overall, there were two phase 3 studies. One study 301, 302, and the pooled result. So you can see the result here. In the pooled analysis of both phase 3 studies, vancomycin had a superior clinical outcome, clinical success compared to vancomycin. And we also did a univariate analysis of factors that predicted success, clinical success. And this is shown here. The factors on a univariate analysis that were significant were, again, vancomycin versus metronidazole, treatment naive or treatment experienced, primary disease versus recurrent disease, and moderate disease, mild to moderate disease versus severe disease. If you look at the multivariate analysis, you can see that, again, vancomycin versus metronidazole difference was significant, meaning that patients treated with vancomycin were more likely to achieve clinical success than those that were randomized to metronidazole. The treatment naive versus treatment experienced was also different. So patients that did not get any treatment at all for C. diff within that 40-hour window period did better than those that had other antibiotics, such as whatever it was at the time. And then mild to moderate CDAD versus severe CDAD was significantly different. So those with mild or moderate disease were more likely to achieve clinical success than those with severe disease. The figure here shows the time to resolution of CDAD, and the two lines were quite similar in that regard, not easy to pull a difference out. And then we looked at recurrence rate. So this, of course, is an area of interest for C. difficile disease. And if you look overall, there was no difference between vancomycin or metronidazole as far as recurrence disease is concerned. But if you look at subgroups, and it appeared that male patients, there was a difference between vancomycin and metronidazole. Metronidazole seemed to do worse in that subgroup. And then patients with non-severe disease. So recurrence rate was higher for metronidazole-treated patients in that subgroup. And then if you look at age distribution for recurrence rate, there seemed to be a trend towards increased recurrence rates with age on those patients treated with metronidazole. And if you look at the safety, there was at least one adverse event experienced by 87% of the subjects. And this is probably not uncommon in a treatment trial for C. diff. And most of the adverse events were mild to moderate severity percentage of vancomycin patients who discontinued treatment because of adverse events. So people were more likely to discontinue metronidazole. And severe AEs, adverse events, appeared to increase with age. The other unexpected outcome was that there was a number of subjects, a small number, but 4%, in the vancomycin tree that reported nephrotoxicity. And this was defined as either renal failure, renal impairment, or blood. And but at any rate, so this is something that probably needs to be followed up. Overall, our conclusion was that patients receiving vancomycin had a significantly higher rate of clinical success compared to metronidazole. And the multivariate analysis, factors that were associated with clinical success were vancomycin treatment, being treatment naive, and having mild to moderate disease. The recurrence rates were similar, and adverse events were common, but mostly mild to moderate severity. Thank you.